and or time. Whenever you're good at this.
Okay.
It's running.
Hello, my name is Cindy Rouse-Sabatka, and I'm here to give you a presentation on essential oils today. I'm a nurse. I'm a registered nurse, been a nurse for 30 years, and have a master's degree in nurse anesthesia, which I've been practicing for 23 years, and I am interested in alternative therapies and complementary alternative medicine now, so I'm going to school at American College of Healthcare Sciences. Sorry about that. So if anybody can guess what this is, can you guess what that is?
Nope.
That's peppermint. Peppermint on the leaf, that's where they get their oil peppermint from. So the objectives I'm going to cover today are, first we're going to define essential oils, discuss active constituents of essential oils, explain distillation process for the essential oils, and describe some methods of administration, some general safety guidelines, and the importance of using the plant's Latin binomial names. And then I'm going to talk about the medicinal uses and therapeutic actions of lavender, frankincense, lemon, and peppermint essential oils, which are my favorites. So what are essential oils? They're essentially plant extracts from stems, roots, resins, peels, flowers, seeds. And you distill them, or their expression, you get the oils are extracted from the plant materials by distillation or expression. And they're volatile, usually colorless, they're not oily, and they're insoluble in water. So sometimes it consists of hundreds of individual biochemical components or constituents. They're very concentrated, 50 to 70 times more powerful than herbs. And so this provides for a diverse range of healing actions in the body. And this is a chart from the American College of Healthcare Science, my textbook. And it just shows the chemical groups that are classified according to their structures and functions. So in the plant's oils, they have various constituents: terpenes, alcohols, aldehydes, acids, esters, ketones, lactones, oxide, and phenols. And each one of those has properties, therapeutic properties. So when an oil has those components in it or constituents, then they will in turn have the therapeutic effects. Like for acids, you'll have an anti-inflammatory property. Esters, they have antifungal, antimicrobial, antispasmodic, and sedative. And that's where lavender comes from. Lavender is very high in ester content, so that's what makes it have a lot of sedative properties. So these are important chemicals. So the distillation process for essential oils, the history is it's been over 5,000 years, and they have had earthenware apparatus that shows that it's been known for 5,000 years. And distillation is still the most common process of extracting oils from plants. It's the method most commonly used is steam distillation. So they take the plant material and they pass it through a retort, and the essential oil is carried out of the plant through the steam, and then the water cools and comes down and changes and separates the oil and the water depending on how heavy that oil is or the specific gravity of it. The oil will either rise to the top or to the bottom. Like birch and wintergreen have higher specific gravity, so they're going to fall to the bottom below the water. And then they just siphon off the water and separate it from the oil. And this is just a closer picture of it to show how easy it is to distill. And you can use your own distillation too in your home. There's factors that determine the final quality of the oil. And it's very important that the plant material itself, it depends on the seed quality, the environment, the growing conditions, the time that you harvest it, the temperature and pressure, altitude, the quality of the distillation equipment, and bottling and storage. Those are all so important for the overall effect and quality of that therapeutic oil. For instance, it's really an art form and a science. And this is an example of the temperature is important because, for example, in lavender, it should be processed at like 245 degrees and 3 pounds per square inch. But the higher temperature and pressure can result in harsh aroma and lessen the oil's therapeutic effects. So it's very important that they get everything just right with the distillation. And the extraction period must be allowed to continue for a certain period of time to flush out all the components of the plant. And some are released more quickly or slowly than others, so it's real important that they know how to properly distill that particular plant. So really an oil can be pure, but simultaneously be of poor quality, so you have to know how to properly distill these oils to get the therapeutic oil. Other specialized extraction procedures are cold pressing, which is done for citrus oils and citrus from the peels of the fruit like lemon, orange, lime, bergamot, and it really involves simply pressing of the rind to extract the oil, and so it's really in its original state, and it retains their bright, uplifting, and fresh aromas, the citrus fruits. The bottom line is you have to really buy a therapeutic oil from a reputable company because there's really no industry regulation or standard. So things to look at are is the Latin name provided, because you definitely need the Latin name, the Latin binomial name. The country of origin where they got the plant, the statement about its purity, the third party testing, or is it organic? And the main thing too is you really need to develop your nose so that your own sense of smell can tell which oil will work best for you. The 3 ways to use essential oils. You can use them aromatically, topically, or internally. Aromatically is from diffusers, or you can have a bath or a steam and inhale them. Topical, it's easily absorbed by the skin and can be safely applied topically, but the dilution often is suggested and required. And the internal benefit, it goes throughout the body, even though the skin will absorb it in your feet or reflex points of your body. Or you can take it internally, but many essential oils are generally regarded as being safe for dietary use, but some oils should not be taken internally, and do not use any essential oil product internally that does not have the appropriate dietary supplement facts on its label. Some general safety guidelines. Because they are concentrated plant extracts, you always have to consider the therapeutic margin or the dose between the desired effect and the toxic effect. And the recommended daily dosage, your duration guidelines, follow all label warnings and instructions. Your essential oils should not be used in the eyes, inside the ear, or on open wounds. As usual, keep out of reach of children because they're very potent. And essential oils are flammable, so keep them away from flames. Some oils can cause sensitization or allergic reactions in some individuals. And you have to make sure you consult your physician before using essential oils if you are pregnant or if you're under a physician's care. So we're going to talk about lavender. Lavender is one of the top 10 oils that most used. So it's Lavandula augustifolia. And it has active constituents of alcohols, esters, and monoterpenes are the main components of it that gives it its therapeutic action. And the esters are different species, different in their content of the ester. Lavender is grown mainly in France, and it's at different altitudes. And the higher altitude lavender is the fine lavender, and that's the one that is has the most sedative effect. And it has all these other components, monoterpenols, and it has the antibacterial, antifungal, and vasoconstrictive and toning properties. And it has a multitude of other smaller quantities of constituents. This is a slide that shows the difference between the species, even though they're lavender, they're hybrid. Lavandin is a hybrid of lavender. But the main difference, if you don't know the Latin name of lavender, because sometimes it's called lavender, you could get a sedating versus a non-sedating oil. because of the cineol and the camphor, lavender does not have any of that, but lavandin does, and that's what makes it more stimulating. It can be actually stimulating and not sedating, whereas the Lavandula augustifolia, is sedating. So that's where you really need to know the names, the Latin names of these. Oops, sorry about that. Let's go back. The therapeutic uses, analgesic, pain relief. You can put it topically on any kind of insect bites, stings, migraines, burns, sprains, teething pain. Oops, wrong way. Other uses, it's antibacterial, antiseptic, and astringent, so it's excellent for all skin complaints, acne, infections, sores, and wounds. It's an antispasmodic. It's a nervine, so it helps tone and heal nerves. And a sedative, that's what it's very good at, just helping you calm and tranquilize your nerves. There's multiple household uses. You can use it as a fragrance, deodorizer, air freshener, surface cleaner, the room spray, and these are just different ways of using it. Lavandin's therapeutic and household uses. It's been shown lavandin that it helps anxiety and stress in 150 pre-op patients with anxiety. In the 2009 clinical study, it showed that it significantly lowered anxiety, and that's a great way to increase patient satisfaction. It helps the camphor, and it helps the cough, cold, and flu, and also with household uses. And it can be used as a natural insecticide because of the camphor. There's some studies with Lavender augustifolia that shows that in post-op tonsillectomy pain, it was actually decreased in the pediatric patients after they were given aromatherapy with lavender. And it decreases the number of required analgesics following tonsillectomy in pediatric patients. And there's another study showing that they took some students in Iran and women that had some severe dysmenorrhea, and showed that the aromatherapy significantly alleviated those symptoms. The cautions and contraindications with lavender is that it can cause skin sensitivity in rare cases, but you always want to do a skin patch test sometimes with any oils that you use. Frankincense is one of my other favorite oils, and its botanical name is Boswellia carteri, and it's extracted from steam distillation. It's a resin, which is this right here, and it's gold, frankincense, and myrrh. It's been around for a long time. In biblical times, ancient, it was more precious than gold. Its uses are for anxiety, asthma, bronchitis, extreme coughing, scars, stress, and stretch marks. But more recently, it's been really used in European and American hospitals in the subject of substantial research, especially with anti-cancer. And these are some studies that I pulled from PubMed.gov, which is a great website, but it shows that frankincense has cytotoxicity for tumor cells, and also for breast cancer. It's showing promising. There's a lot of studies on its effects. Essential oil, lemon. Lemon is its part that's used is the outer rind, and at the lemon tree, one tree produces about 200 fruits annually. It's a very, very popular essential oil and has multiple uses. The distilled oil is the less expensive kind. It's from the inner part of the peel, and it's an inferior product, so it's not the therapeutic oil that comes from the outer rind, which is the expressed oil, and that's the preferred method when you want the therapeutic oil. There's 3,000 lemons produce 2.2 pounds or 1 kilo of oil, which that's a lot of lemons. And these are the active constituents. So the limonene, 70%, is the terpene, and then monoterpenes, and has aldehyde in it. So you remember that chart that shows you all the beneficial effects of it. It's a great for digestive problems, constipation, diarrhea, heartburn, indigestion. It kind of counteracts stomach acidity. It stimulates your liver, gallbladder, and pancreas, and you can add just a drop to a half glass of water or put it in tea up to 3 times a day. It's great for the skin. It's an antibacterial, antiseptic, and disinfectant. You can use it as a compress. It's an astringent for your skin, for greasy skin and blackheads. And you can put it 5 drops in 1 cup of water and put it on the area, or mix lemon oil with milk and apply to your face. But avoid the eyes because it would sting. So again, a cosmetic, an expectorant, which means it's used for coughs, colds, and sinuses, and encourages the discharge of mucus from the bronchopulmonary passages. Antiseptic and antibacterial, and an anti-inflammatory. It can cause skin irritation and sensitivity, and most of the citrus oils can do that, so you have to be careful when you're out in the sun because it's a photosensitizer potentially, so you can burn more easily, and so you have to be cautious with that. Now peppermint is another popular oil. It's one of those top 10. The United States is the largest producer of peppermint, and it comes in you use the leaves, flowers are picked just before maturity when the essential oil content is greatest. And this is my peppermint plant. Some active constituents. The main constituent is about over 40% alcohol L-menthol, which gives it the cooling taste and the characteristic cooling taste of peppermint. The menthone is a ketone, and it's a cell proliferant expectorant and has vulnerary actions. And then there's an ester in it, which gives it its minty aroma. And it has many other constituents in smaller quantities. Multiple therapeutic uses. This is just a few, but the main thing is it's an adaptogenic oil, which means that it can sedate or stimulate depend on what's needed. It's great for pain, topical. It's an anodyne, so it's with cramps, headaches, insect bites, itching, any kind of wound, shingles. Great antispasmodic. Great for a powerful oil for gastrointestinal system, antacid, carminative, stomachic. The muscular system, you put it on bruises. It's good for rheumatism, tennis elbow. Common applications, you can apply it topically, aromatically, or internally. When someone says you can apply neat, that means no dilution is needed, but you can dilute. You definitely want to dilute it with children or people with sensitive skin, and when using it topically. You can put it on reflex points on your feet, your hands. Diffuse or inhale aroma directly. Put it under your tongue for a beverage and take it in capsules. Use it in cooking. There's multiple uses of peppermint. Some of the safety data, repeated use can cause contact sensitization. Use with caution in dealing with high blood pressure or during pregnancy. Don't get it in your eyes because it'll burn. And do not use directly on damaged or sensitive skin, and you might want to use a skin patch test to make sure you're not having any problems with it. There's multiple references, many excellent references. PubMed.gov is great. You can look up any oils. AromaWeb, everythingessential.me. And does anybody have any questions? No? No questions? All right, well, have a good day. Thank you.
Thank you.